Yeah, so adaptive servo-ventilation can be a great tool to help with especially the sort of unstable endotype of central sleep apnea, whether it's sort of pure central sleep apnea or treatment emergent central sleep apnea. And this goes back to a prior study that connected ASV with a higher risk of mortality in patients with low ejection fraction heart failure who were put on ASV. There's been some more recent studies that haven't found that connection. And even the original study, the only connection was actually in the subset of people that had the lowest EF, primarily central sleep apnea at baseline, that mortality risk was seen. And so some of the new recommendations are, saying it looks like, especially the newer algorithms of the newer ASV machines, as well as this newer data comes out, looks like it's much safer to consider ASV regardless of sort of the ejection fraction. And I think especially if you have patients who are more the treatment emergent type, we really never had data that population was unsafe in. So my current practice is, you want to make sure when we're putting people on any PAP machine that it's actually helping them. So are they feeling better? Are they, is their AHI coming down? Maybe we check, oxygen levels, are they coming up? If all those things are aligned, I think it's very unlikely that you're causing harm to that person. But if you put on a person on an ASV machine and they're coming back to you and saying, my sleep is worse, I'm feeling worse, you should be, thinking of that, of, what's going on here? Are you having pressure fluctuations that could be affecting them? So I think we can consider it in almost any patient now, but I think that follow-up is really important to make sure, not only they're on the right machine, but the right setting, they're using it well. ASV is very sensitive to leaks. So is the reason it's not doing well because, you're don't have the right mask or something like that. So I think it's a tool we can expand use and just follow closely and look for those positive benefits.